In the intense world of medical emergencies,
one patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on your pals.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, in a rush hour collision, a motorcyclist is thrown headfirst from his bike.
Mate, can you hear us? He hasn't got a radial pulse. Is he breathing?
A builder's leg is sliced open.
That piece of metal has gone through your skin. You can see muscle and fatty tissue.
A man in cardiac arrest.
Anything on that ECG?
And medics' lives are in danger as they treat a patient with suspected coronavirus.
Hi, guys. We're not going to come in just yet. We're just going to have a chat to you, if that's all right.
Clear guard, breathing filter.
It's Monday morning and the start of shift for Pete Edwards.
I don't know whether I'm a morning person. The first hour or so, I take a little bit to warm up.
He's been working in the ambulance service for 15 years, the last 2 as a highly trained critical care paramedic.
It's just the initial getting up, isn't it? Get a cup of coffee, and that's it. It's all good then. Get the vehicle checked, and then it'll be on to crew welfare, as we call it.
But today, there is no time for any morning cuppa.
Ambulance services, patient breathing.
Let me just go over. Is he breathing? He is breathing.
Are they conscious?
No, he's unconscious. He's bleeding quite badly. His helmet's come off. Got a severe gash wound at the top of his head.
Was it a car versus a motorbike?
Yeah, car versus motorbike.
We're heading towards a patient that has been reportedly hit by a car. The initial call said the patient was in cardiac arrest, so it obviously sounds quite serious.
An ambulance has already been dispatched, but the biker is thought to be so badly injured that Pete and another critical care team are being sent to give life-saving treatment.
Because of the nature of the job, they've also responded Halemed 03 with a medic on board, and that'll be coming from Cosford.
Helimed 03, a Midlands Air ambulance, is also scrambled. On board is another critical care paramedic and a trauma doctor, qualified to carry out roadside surgery.
6-2 at scene.
Once on scene, Pete is briefed by the ambulance crew.
Hi, guys.
Hi.
How are we doing?
Helmet came off in the crash.
Has he been speaking to us?
Not at all. We've been like this since we got it.
OK.
21-year-old Curtis has been thrown from his motorbike after colliding with a car. In the impact, his helmet came off before his head hit the road.
OK. He's a bit agitated, isn't he?
Curtis has a severe head wound.
It's quite common when we get this sort of patient. Big head injuries start getting agitated. It's not intentional, he doesn't know what he's doing. He's got a really reduced level of consciousness. Has he got a radial pulse?
Yeah.
OK, let's see if he'll tolerate an oxygen mask, all right? Let's pull his stuff out. Yeah, that's it. We'll see if we can get him onto the scoop as best we can. His GCS, his eyes are open.
To try and evaluate him, Pete uses the GCS, or Glasgow Coma Scale.
Mate, can you hear us?
Usual hazard zone C.
Okay.
A scoring system that helps describe the level of consciousness. A normal score for speech is 5.
Verbally, he's probably a 2, isn't he?
Further indication that Curtis may have a traumatic brain injury.
We want to protect his brain, and by taking over his ventilation and us doing it instead of him, we can protect his brain and stop it swelling, hopefully. That means putting him into an induced coma.
Breathing automatically with a ventilator will allow Curtis's brain time to rest, calming the swelling. But an induced coma is a risky procedure, usually only carried out in hospital.
Are we treating it as life-threatening this time?
I would say it's got the potential for that, yeah.
The critical care team carry drugs and anaesthesia, normally only used in hospital operating theatres and intensive care units.
We start the interventions that they start in hospital, we start them early and get people to hospital in the best shape that we can.
I'm just going to get some midazolam, and then at that point we'll put them onto my ventilator because it's just a bit better for them, if that's okay.
In cardiac arrest cases, these roadside treatments can make the difference between life and death.
Ambulance services, a patient breathing.
He's passed out. I can hardly feel him breathing.
So he's not breathing very often at all.
No.
You at home?
Yeah, I'm the wife. He's sitting in the car. The next door neighbours.
Okay, brilliant. Put your neighbour on the phone for me.
Hello?
Are we able to get him out of the car and onto the floor?
We can do, yes.
Do that straight away for me. You need to start doing some basic life support.
Oh my God, I've never done this before.
I can talk you through it, sweetheart. What I need you to do is stop pushing down hard and fast, okay? You need to go 2 times a second.
1,
yeah,
2,
that's
1,
it. Keep going at that
2,
speed. Fantastic job.
2, 1, 2.
No, don't worry about pushing too hard, okay? Keep your arms straight and just keep going for me.
1, 2. The ambulance on its way.
Yes, it's already on its way, darling. I've got them coming to you as quickly as I can get them there. They are coming on blue lights, okay?
8080, male cardiac arrest in Halesowen.
An 80-year-old man is in cardiac arrest. As well as dispatching an ambulance, the code red emergency is passed to critical care paramedic Rob Davies.
Go ahead.
Yeah, basically, we'll take quick update for you. The patient will take an occasional breath.
In cardiac arrest, the brain stops sending signals to the heart. It stops beating and oxygen ceases to pump around the body. Only 1 in 10 of hospital cardiac arrest patients survive.
What was the call connect time, please?
Yeah, call connect was at 15:52.
Yeah, 15:52 call time. Yeah, roger.
Without CPR, the brain can be irreparably damaged in just 6 minutes.
The call connect time that I asked for is the time that the call comes into the ambulance service, so that'll hopefully give me a fairly accurate time of when the cardiac arrest was identified. So we're about 10 or 12 minutes into that now.
Rob arrives 14 minutes after the call, by which time the ambulance crew are already on scene.
How are we doing, guys? You all right? Yeah, good. How are we doing? Still breathing for himself? Brilliant.
Feeling unwell, 8-year-old Keith asked his wife Monica to drive them home. As they arrived, he collapsed.
Is he prescribed anything?
Yes, but he stopped taking it now.
Right.
He doesn't take any medication. Nothing wrong.
It's all in a quick time frame. He was making some gurgling noises.
Fine.
She's pulled up, gone inside, called for us, neighbours stopped to help.
Okay.
So it's all in a quick time frame.
A neighbour gave Keith CPR and got his heart beating again.
He was making some mild respiratory effort during the CPR. 1 shock, return of circulation.
Beautiful. Good work. I'll just go and draw some drugs up, right? So the gentleman's had some bystander basic life support, some chest compressions. On the arrival of the paramedic, he's found his heart to be in a rhythm that he can shock. He's given him a shock through the defibrillator, and now he's got a pulse back. I'm just going to drop a little bit of sedation, just so that we can help with his breathing. Let's have him up and out then.
Although Keith's heart is now beating, there's a danger it could stop again.
And then we'll just place him on there.
Up to 79% of hearts re-arrest before reaching hospital.
We got him up and away.
Critical care paramedics like Rob are specially trained to fight those odds.
Just hold his arm there, chap. I can't reach it. There we go. Right. So, plan is then, if somebody can stay in the back with me, what I'd like to do, we can have a little look and just see if we can give him a little bit of sedation and then just get him onto an eye gel.
To ensure sufficient oxygen reaches his lungs, Rob must insert an eye gel tube down Keith's throat so the paramedic can control his breathing.
Yeah, if you can chuck a bit of lube on it. Okay, so just go with him on that. Can you do the ECG?
An ECG, or electrocardiogram, records the electrical activity of the heart.
Just give him a little bit of sedation just so that we can ventilate him a bit better. We might look at a bit more of that. Okay, let's have the rest of these clothes off. Anything on that ECG? All right, chap. Georgie, how long to the QE?
About 15 minutes.
15. Lovely. Smooth, but rapid, lovely.
Keith is seriously ill, but Rob's goal is to get him to the nearest cardiac centre alive.
OK. Still going against that a little bit, is he? We can go.
Dr. Matt Rowley and critical care paramedic Tom Waters are starting their shift just as paramedic Kerry Penn-Ashman is finishing hers.
Remember your PPE, remember to wipe over the cloth.
These medics are used to facing danger, but at the outbreak of the coronavirus pandemic, the level has significantly increased.
Following the corona outbreak, how we approach people and how safe we've got to be has just completely changed.
Coronavirus has huge implications for us as healthcare professionals, and it means that we're having to be more careful about how we protect ourselves. We're having to carry quite a bit of PPE, which is personal protective equipment, stuff that protects us against this particular virus.
Without PPE, patients might unknowingly infect the medics with COVID-19, and the medics might infect their patients with a deadly virus.
Because there's a potential that we're going down to the patient's face, that we're going to do things that might mean that the patient is going to get droplets of sputum, any sort of bodily fluid, into our space. So you have a hood that fits onto your face, that goes over the top of your head, and then you have a little portion there that fits onto these sorts of respirators, and you put that on your face, and that gives you quite a few hours, potentially about 6 hours, of good, clean air.
For most of the critical care team, the need for PPE in the eye of a pandemic is a new experience, but not for paramedic Tom.
Did Tom tell you he was out when the Ebola outbreak happened as well? Went out to volunteer, didn't you? Bit of a hero, aren't you, really?
Ambulance services, the patient breathing? Not very well. Are they awake? No, he's unconscious. How old? He's 60. Is it regular breathing? No, it's not regular breathing. Not, okay. He was just standing at the end of the bar. He just dropped to the floor. He banked his head on the edge of the bar and he went unconscious. We're coming as quickly as we can. Don't be alarmed if they come in wearing face masks, okay? Oh, right, okay. Yeah, don't be worried about that. No problem at all.
A collapsed man with a suspected head trauma can be a Category 1 emergency.
Yeah, okay, that should have come through now.
A local ambulance is almost at scene, and 30 miles away, Tom and Dr. Matt are en route, but want to know if the patient could be a risk to them.
Have we got any symptoms that are suspicious of COVID for this chap before we go anywhere near?
I believe that was affirmative. He's high risk for COVID. He come through with coughing and difficulty breathing.
As the patient has suspected coronavirus symptoms, the medics need to wear their PPE, but it takes several minutes to put on. Precious time that could be used treating him.
With the nature of what's going on at the moment, we need to make sure that we protect ourselves with our personal protective equipment, and we'll make a decision from there.
Tom and Dr. Matt might need to save their patient's life while knowingly risking their own.
If we need to do advanced procedures and interventions, we will do them, but we have to balance that against the personal risk and also the risk of not delaying that patient getting to hospital. I think definitely when we get back, we need to get the hoods and stuff out now.
In Oldbury, critical care paramedic Pete is treating 21-year-old Curtis, who has been thrown headfirst from his motorbike after colliding with a car.
Let's just try and keep him as still as we can, all right?
The impact dislodged his helmet, and he now has a suspected brain injury.
Pop his legs onto there. We'll get him on the stretcher. I think he's a bit hypertensive because I can't feel a radial pulse.
Curtis's condition is so serious that he needs a trauma doctor to put him into a coma to protect his brain. But the air ambulance carrying one is still 8 minutes away.
I think the priority, right, if we can get him on the back of the vehicle and we can do a proper assessment on him, we'll get some access.
Curtis is losing blood from his head, but his weak pulse indicates internal bleeding too.
We'll get full monitoring on him. We'll see what his BP is. I suspect his BP might be low, so it may be that he needs some TXA, all right. Well, if we could get some head blocks on just to keep his head still, all right.
So you've got IV access,
Nice one, all right. Is that the TXA, is it? Yeah.
Pete needs to give Curtis tranexamic acid, or TXA, which helps prevent excessive blood loss.
Let's get full monitoring on him if we can, and let's see what his observations are. Let's cut his trousers off and get that skin to skin. All right.
The doctor on board the air ambulance is now just moments away, but Curtis is deteriorating by the second.
Is he breathing?
Yeah.
His respiratory is very shallow. It's obviously quite poorly. Let's get an airway in him if we can. What we might need is a BVM as well once we've got that. So let's get that eye gel in first.
29 minutes after the 999 call, the Midlands Air Ambulance arrives with critical care paramedic Ryan James and trauma doctor Ben Taylor.
He's collided with that car, or the car's collided with him. It's thrown him off, his helmet's come off in the impact. He's got a big head injury. He's been spontaneously breathing, although he's very shallow. I'm setting up for RSI.
I'll leave you set up, carry
on. Yeah.
I'll assist.
All right, yes, please, yeah. Is that all right?
Sort of drugs up.
Yeah. He's had some TXA due to mechanism. Yeah, I've drawn some ketamine off. There's 160 left there, Ben, because he's had 40 out my 200.
The critical care team use a range of powerful anaesthetics, like ketamine, not carried by ambulance crews. They can also perform procedures normally only done in hospital.
We're going to give an anaesthetic just to protect his brain and give him the best possible chance of recovering from his injuries.
Putting Curtis into an induced coma might give his brain precious time to recuperate and encourage any dangerous swelling inside his skull to subside.
So plan to the RSI within the next 5 minutes.
To place Curtis into a coma, he first requires RSI, rapid sequence induction, an advanced critical care respiration procedure that Pete decides is safest to do outside the ambulance.
Because the process is quite risky, we need to have 360-degree access. So if the patient starts to deteriorate for any reason or we're having difficulty with the airway, we've got good access and we're not sort of fighting over each other.
Dr. Ben then prepares to put Curtis into a coma with 2 injections, a sedative and a paralysing agent.
BVM.
Yeah, on.
End-tidal.
End-tidal's on, reading at 3.0.
BP systolic.
The last systolic was 127.
And cycle set.
Cycle set every 3 minutes automatic.
Saturations. Is that okay? Drugs going in now. Okay, fentanyl's in. Ketamine is in.
Okay, everybody ready? Okay, so oxygen mask is coming off. Okay, there's no loose teeth that we've seen. So I've got the blade and I'm going to open his mouth as wide as I can.
We're going to go for the video
So
scope
we've got
first.
video scope first,
Yeah.
with a size 4 blade. Okay, we've got a backup of a Mach 4.
Yeah.
Batteries checked, charging.
Okay.
A laryngoscope, a camera with a screen, allows Pete to look into Curtis's airway for obstructions.
I'm going down the right-hand side of his mouth, sweeping the tongue to the left, and I'm going to walk down as I go and looking for landmarks. I've got the epiglottis, but... OK, a bit of suction, please.
Suction.
There's quite a lot of phlegm at the back of his throat.
What should we like?
OK, I've got a grade 1 view there, I can see the cords.
With a clear path, the breathing tube can be inserted into the trachea.
OK, I think through the cords and the black line, we are 22 at the teeth, Ben. OK, we've got misting of the tube. OK, I'm coming out with the blade. Cheers, thanks.
Curtis is now in an induced coma and breathing with the aid of a ventilator. Dr. Ben and the ambulance crew have done all they can.
It's nice and steady, buddy.
The importance of our services, we're bringing some of the emergency department to the patient rather than the patient having to wait to get to the emergency department. He's been anaesthetised a lot faster by us getting a doctor quickly to scene, so we've saved him some time and hopefully improved his outcome that way.
Critical care paramedic Alistair McNeil has just come on shift, and romance is in the air.
It is Valentine's Day today, so whether we'll get any squabbles between couples, you never know.
Paramedics are much more likely to deal with violent crime than lovers' tiffs. Last year, there were over 90,000 in the West Midlands alone, many ending with on-street life-saving trauma treatment.
Ambulance service. Hi, please.
Father has beaten son with a pole, potentially. The son has a hole in his head and he's bleeding. The son's 37 and the father is age 63.
Is there a lot of blood there, can we ask?
The blood is dripping. Brain matter cannot be seen. However, there is a big hole.
A violent assault likely to result in catastrophic brain injury is an immediate Category 1 emergency.
So we're often addressing Dudley, which is coming through as a serious assault, I believe. Somebody battered with a pole.
With over 14,000 physical assaults a year on emergency workers, critical care paramedics like Alistair are in real and present danger.
There's potentially some suggestion whoever's got this pole and has been battering somebody is still on scene or near to scene. I believe Control are liaising with police for finding a standby point for us. 6-2 over.
When you go to the junction where the Tesco is, probably just pull in there.
Yeah, mate, that's all received. I can picture where you mean, Spitchy, mate. It sounds like there is somebody who's carried out potentially a serious assault.
His patient may have potentially fatal brain injuries, requiring urgent trauma care. But for his own safety, before Alistair can approach the scene, the police must declare it safe.
The annoyance is that we could be delaying care here. The police know far more about this than we do.
You can
collapsed, went to an emergency rest, Rosk. They were still trying to ascertain a BP.
Critical care paramedic Tom Waters and trauma doctor Matt Rowley are on their way to a collapsed patient displaying symptoms of coronavirus. And they've just heard that the man's condition has become critical.
So there's an ambulance crew on scene with a patient who has had a cardiac arrest. They've resuscitated him and managed to get his heart restarted again. Because his heart has been stopped for a period of time, there's been a lack of oxygen going to his brain, so now that his heart has restarted, he's quite agitated and combative, and they're struggling to manage him at the moment. So we're going to try and intercept them on the way to the hospital and see if we can offer anything, potentially giving this man an anaesthetic to stabilise his condition and transfer him onto hospital.
They've decided to meet the ambulance en route, as it will save time and ensure the patient gets vital treatment as quickly as possible.
We're going to make a rendezvous point for, we're thinking M42 junction 9, crew only just leaving scene, so that looks like it's going to be the best place.
The issue that we've got with this patient is they're quite a long way away, so the plan ideally is going to be for them to load the patient on the ambulance if it's safe and then travel towards us and us meet them on the way to hospital just to try and save delaying any time there.
If we're looking to RSI, it's going to be aerosol generating procedure. So this triggers for high risk PPE, so that's for high risk PPE. So
Yeah, well, I mean, we are at the RVP anyway. We'll wait for the crew to get to us.
If the patient's heart stops again, Matt and Tom may have to perform life-saving interventions in the closed confines of an ambulance on a patient suffering a killer virus. If so, they'll need their PPE, but it takes 10 minutes to put on.
So what we might do is just open the door, just chat to them, and then make a decision from there. Hi guys, you're right. We're not going to come in just yet. We're just going to have a chat to you if that's all right. From our understanding, it's a cardiac arrest. You've then shocked him, or
No shock. No shock. CPR. 2 lots of adrenaline.
Okay.
And we got a Ross back.
Yeah.
Went off again. CPR. About 2 minutes. Come back, Ross. Maintain his own airway sync.
I honestly think that by the time we've donned, it's going to take us 20 minutes. So I think if you're happy, we just drive, we'll follow behind you. It's not a point of us not wanting to do it, but I think by the time we've done it, we'll be there. Okay.
Perfect, yeah, I'm over that.
This patient has an airway, is a GCS of 15, is bradycardic. So we have 10 minutes.
Tom and Matt decide the best course of action is to follow the ambulance and not delay its journey further.
So the plan currently is to follow the crew into hospital. Should they need any assistance, then we're here. We'll have to pull over and have to get our PPE on. But ultimately, the best thing for this champion is to get him to hospital as quick as possible. Pete, just planning ahead, have you spoke to Heartlands? Because obviously, if we put this in as a high-risk COVID, it's going to put the hospital into probably a bit of a state of emergency. Have you had a discussion with Heartlands already regarding this?
I haven't, no, but I certainly can do.
Emergency departments will have a protocol that they now follow for patients that will attend with suspected COVID-19. Again, that is probably going to tie up a significant amount of staff. So yeah, it's probably going to need an RSI on arrival. So again, if you do the high-risk COVID thing, that'll be great, and we'll be there in just under 10.
It's cumbersome and time-consuming to put on, but over the next few weeks and months, the NHS will come to rely on supplies of PPE like never before.
Quite rightly, the ambulance crew that had treated him had put their high-risk personal protective equipment on, which involves a suit, boot covers and a respirator, so that they're not breathing any infected air or any infected air droplets around them. For us to do that would probably take around 10 minutes for myself and Tom to both put our PPE on. So that's 10 minutes wasted where the patient needs to be at hospital and at definitive care. So because the patient was relatively stable at this point, we made the decision not to delay things further, but to escort the crew to hospital with us being available should he need any interventions.
The patient is transferred into a COVID-19 ready cardiac unit.
Numbers at the moment: pulse 115, 14191, end tidal 4.2, sats are 86%, but he's cold.
In Halesowen, critical care paramedic Rob Davies is en route to hospital with 80-year-old Keith, who is critically ill following a cardiac arrest.
Go 50 to start off with. Does that sound reasonable?
His condition is so serious, Rob phones ahead to discuss his plans for treating Keith.
My plan is to give him some rocuronium just so that I can just better ventilate him.
Rocuronium bromide, or ROC, relaxes the muscles and allows the team to completely control Keith's breathing and optimise the oxygen getting into his body, which is vital after a cardiac arrest.
He's probably 80 kilos, something like that. So 50 seems about reasonable, doesn't it? We got a good end tidal trace.
A correct dosage is crucial.
Essentially, what we're trying to do is buy some time to keep the major organs oxygenated, primarily, you know, the brain, heart and lungs. I'm going to have that out, so some vomit there.
But Keith's condition worsens when he begins to vomit.
Okay.
To prevent him from choking, Rob uses a suction probe to clear Keith's mouth and throat.
Let's just have the... You've got it there, I'll just go down the side. So the end tidal, I think, is blocked now, so you can hear it, yeah.
Vomit blocking his ventilation tube could starve Keith's brain and other vital organs of oxygen.
Just going to get a new end tidal. That's what we're going to do, just going to swap that out. Swap that straight onto there. Okay, so if you vent on that, that one can go on the floor. We've got an tidal back.
Airway cleared, Keith stabilises and now has a chance of survival.
Early bystander CPR and early defibrillation make a massive difference into this patient group. By doing that CPR, we then have a viable heart, which to shock. If nothing was done for that gentleman, I think it would, well, no, it would be a very, very different outcome. What I'd like to do is just strip all this off him. Doesn't need these.
52 minutes after the 999 call, the ambulance arrives at hospital, where Keith is handed over to the team in A&E.
Okay, let's go. So he's got pulse back. We tried to sort his airway out. It's quite difficult. He's on a ventilator, and it'll be 24, 48 hours, I think, before they perhaps try and wake him up and see how he is neurologically.
Critical care paramedics undergo 2 years of specialist training for code red emergencies.
Right, we're going to cut this off.
Whether it's resuscitating a person in cardiac arrest or saving someone after a horrific accident.
You're doing a great job. Sit, well done. Nice deep breaths. Nice deep breaths. Keep going.
7062, go ahead.
And a call's just come through that's about to test the trauma skills of critical care paramedic Steve Mason.
Roger. Thanks a lot for that.
Ambulance service for the patient breathing? Yes.
What's happened?
Had a cut leg, quite a bit of blood loss.
What's it, Brad?
At a basement construction site. Just cut his leg on something down there.
How much blood did he say he's lost?
Fine.
Don't move in. We'll be there as soon as we can.
Accidents on building sites can be extremely challenging for the critical care teams. Dealing with life-threatening injuries in hazardous environments calls for calm under pressure. An ambulance crew is already on scene, but because of the potential severity of the accident, Critical care paramedic Steve is also en route.
62, just arriving on scene. Is there any other resource on scene?
The crew have booked an attendance 1406 over.
Soon after the hoarding, take a left.
OK, cheers, buddy. Thank you.
Arriving at the site of a large office block development, Steve is directed down to the basement level.
Roger, made contact. Let him lift up with his good leg. There we go. Shift it across onto here.
59-year-old Mark is being looked after by colleagues who bandage the wound with a towel to try and stop the bleeding.
Step back, constantly.
What, and that's... It's not really sharp, is it? Quite sharp?
It's not even sharp, is it? It's just...
Yeah.
Mark was carrying some pipe when he fell 2 meters onto the end of a scaffolding pole, which has sliced into his calf, leaving a wound at least 2 inches deep.
62, just a brief update. Got 59. Can't get any signal around here, so...
With no signal underground, Steve is unable to contact the regional trauma desk to ask them to alert the hospital that Mark may need urgent surgery. The ambulance crew carry him out to the back of the ambulance, where Steve can properly assess the wound.
So how did you do it?
Trying to take some pipe down, I just lost my footing.
So you must have fallen down, because it's not that sharp, is it? But because, I suppose, with your body weight falling down, probably caused it to go through your car. Was it spurting, do you know, or...?
Well, I didn't use spurting, it was coming out pretty fast.
Was it? Okay.
He's already lost a pint of blood. If the wound is spurting, it means Mark might have cut a major artery.
Just get ready, just in case it starts spurting.
In Dudley, there are reports of a serious assault, a code red emergency.
Sounds like there is somebody who's carried out potentially a serious assault and could well come back to this address, so don't really want to be in somebody's living room when somebody comes back with a weapon.
Critical care paramedic Alistair McNeil is awaiting police protection before he can approach the house.
6-2 over.
Paramedic police on scene.
I'll go and have a look if they're happy.
Once given the all clear, police give Alistair a brief assessment of the scene. It's 4:25 p.m.
Hello. Are you all right? Have we got a large hole in the head or not?
Two males in here, yeah. One's got an injury to his mouth, smacked in the face.
Right.
And the other one's got the injury I can see is on his head here. Bit of a wound, maybe about that.
Fair enough. Well, let's come and have a look at him then. Okay.
Yeah, very sad.
Right, folks, what's happened to you both?
He's got it, I'll kick through the head.
Okay.
Push through the floor and into the head, yeah.
Okay. Any weapons used on you?
No.
No? And is it literally just your heads that have been hit? Were you knocked out when this happened? Can you remember? Can't remember. All right.
Harry says he and his son Alan were attacked on their way home from the pub, but no weapons were used.
How much have you had to drink? Can you remember? Or do you know, Harry? How much have you both had today? Few cans. Look at my nose.
A drunken brawl is not usually a code red emergency, but Alistair is concerned by Alan's demeanour.
And while you've been with him, has he been drowsy like this? Because he's a bit sleepy. Was he like that beforehand because of the alcohol, or is this...?
He's concerned Alan may have concussion, a type of traumatic brain injury.
I guess we're heading towards... Are we popping him to hospital? Yay, nay? I'd say probably yay, because of the drowsy, yeah. Which comes to you, Alan. Are we popping you down the hospital? You're a little bit drowsy with a little bit of a lump on your head.
I'm all right.
Yeah, the problem, Harry, is he's a bit drowsy, isn't he? While we're talking to you and you're aware, he keeps sort of nodding off to sleep.
Yeah, I'm sound as a fan.
We really are not going to win, are we? I don't think we're quite at a point where we can force.
Because Alan is just about conscious, the law says Alistair cannot make him go to hospital.
We'd really like him to get some attention in hospital. It is what it is, I'm afraid. Just can't make them go anywhere. If you can't wake him up at some point in the next hour or two, you need to call 999. Okay? Yeah. Anything that's giving you serious concern, we need to know and come back. Yeah? Make sure you ring us if something changes. Okay.
And so it was bleeding quite a lot. Can you move your foot? Yeah. Good.
On a Birmingham building site, construction worker Mark has lost a lot of blood after falling and ripping open his right calf on a scaffold pole.
And that's the only injury that you've got at the moment,
just that one, yeah.
Colleagues bandage the wound, but now critical care paramedic Steve needs to assess the injury and see if it requires immediate surgery.
I'm going to cut your jeans up a bit, fella.
Okay, bye.
So if you get the bandage ready.
A serious arterial wound can result in death in 5 minutes.
So who did this? Your colleagues?
Nice, yeah.
Yeah, they did really well then to stop.
Yeah, it's pretty
It's a little bit soaked. Okay, so what we'll do, I'll cut it, keep the pressure on it, and then lift, and then have a quick cursory look. You know.
The soak-through temporary dressing is removed to reveal an 8-inch wide gaping wound.
Oh, so let's cover it up so I can see muscle and fatty tissue. You know, it needs some cleaning and hospital. Probably need to go to theatres for it just to get it washed out.
Yeah.
That piece of metal has gone through your skin and gone through the muscle sort of layers. Yeah. But you've got good circulation, you've got good movement. So it's just an isolated injury. So we're just going to find out the best hospital to take you.
Yeah.
Confident that Mark isn't at risk of bleeding out, Steve now wants to get him to hospital as quickly as possible.
Hi, Ben, it's Steve. Hi, mate. Yeah, it's not very good. So you got a 59-year-old male patient that he was working up on a little bit of a height, and then he's sort of fallen back. And as he's fallen back, his right calf has gone past a metal sort of sharp object and sort of torn his right calf open. But it's the whole length of his right calf. So GCS of 15, heart rate of 68, blood pressure of 167/73. It does look quite nasty. There's some skin loss, so I'll probably think it's probably best to go to the QE just because of this injury.
Mark's wound may require a skin graft, so he is sending him to the specialist doctors at Birmingham's Queen Elizabeth Hospital.
So you don't want any pain relief at all?
No.
You're happy?
With the situation under control, Steve decides to leave Mark in the care of the ambulance crew for the journey to hospital.
Happy?
Yeah, happy, thank you.
Look after yourself.
Thanks a lot, thanks
Yeah. No worries.
All good.
As Steve waits for his next emergency, he can reflect on how much worse things could have been for Mark.
What we need to be worried about is people suffering with catastrophic hemorrhage. So if it had nicked an artery and they hadn't have got pressure on that to stop that artery from bleeding, then things could be a lot worse. But although it does look quite bad, you know, hopefully it'll make a speedy recovery.
In the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got one male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a desperate 999 call leads to multiple casualties in a major car crash.
There's people trapped in the car. She's covered in blood. And she's screaming.
Where's your worst pain? In your chest?
A woman with asthma suffers a cardiac arrest.
Let's get some adrenaline. We've got 40 seconds until the next rhythm check.
A scooter accident inflicts devastating injuries.
Yeah, we're on it. We're on it.
Get your pain sorted out, mate.
And police, fire brigade and ambulance race to the scene of a stabbing.
Any details as to whether they're conscious breathing or not? Over.
Heavy blood loss.
Right, that's done. Yeah. So I've got all the amps and kits in here.
At the Queen Elizabeth Hospital in Birmingham, critical care paramedic Ian Locke and Dr. Richard Brown have just dropped off a patient and are restocking their fast response vehicle with drugs and equipment for the rest of the shift.
We're going to try and get all the kit together in good order. So if we are required that we know where the essential kit is ready to go. So organised chaos is how I'd like to describe it.
Hello?
I've had a car crash, please, from an
Okay, are you injured?
Yeah, really bad.
Okay, all right, listen, what's the address? Where are you?
I don't know.
Ask somebody to help you.
I thought I'm in the middle of the road.
Okay, are you out of the car?
Yeah, the car's in the tree.
The car's in the tree?
Yeah, but my brakes are trapped.
How many people are in the car?
3.
We found you, my love. Okay, stay on the side.
I think I broke my back. Ow! 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 Ow!
4 ambulances, multiple police units and 2 fire engines have been called to the site of the crash.
Mike Delta 98 on channel, leaving QE now.
Critical care backup is also urgently required, so Richard and Ian need to get there fast.
Got one male, 2 quick males, still trapped in the vehicle. One possibly got an impalement injury on a tree timber.
Hi, Delta 98, that was all copied. Our ETA is approximately 3 to 4 minutes, over.
With multiple casualties, this is a major incident, requiring all the emergency services to work together to save lives.
My Delta 98 at scene, over.
Roger, thank you, all see.
Right, Tim. How you doing? You all right?
On arrival, they are briefed by West Midlands Ambulance Tactical Incident Commander Tim, who is coordinating the whole emergency effort.
So we've got one patient that's been ejected on this ambulance here. We've got 3 more in there. One has just been dragged out, a male patient. got some concerns over his airway. Okay. We've got 2 more patients in the back. They're lying on top of each other at the moment, so we're just trying to get a plan to get them out.
Okay.
The 4 friends were returning from a restaurant when the car lost control before hitting trees and landing on its roof. One female passenger in her 20s was ejected from the vehicle and has just been moved onto the ambulance.
If one of you can have us a quick look, because they're pretty much packaged and they can get going.
Okay, right. Can I have a quick eye on this one? Yeah.
If you could also look at the chap that they dragged out that's potentially got airway.
Yeah. Hello guys, you all right?
How you doing? You okay?
Hello. What have we got? Very quickly.
The patient on the ambulance is the woman who called 999. She is complaining of severe back pain. She is also bleeding from a head injury.
Jack, very quickly, patient 1 is the ejected female, is a GCS 14/15, good bilateral radials, moving all 4 limbs. We'll get the crew to ring you when they're ready to go with an atmist for Worcester. Okay.
With her spine immobilised, Ian and Richard decide that she is stable enough to be taken to hospital.
Right, that's patient 1.
An ambulance crew prepare to take her, leaving the critical care team to assess the rest of the crash victims.
That one's going to Worcester. You want to just have a look at the one that's been dragged out?
Yeah, if you don't mind.
Where are they? Just point us.
It's this person with green shirt on the floor here.
Have a look over here, okay. What have we got?
The driver, a man in his 40s, is in a much more serious condition.
Is he speaking to you at all? Just about, yeah.
He was pulled from his seat by the ambulance crew and is now on a stretcher and only semi-conscious.
This chap dragged out. He was not able to be laid flat at all.
Okay.
He started to come back to roll to his side. Quite a lot of blood coming back of his airway.
Okay, so I'll just get around that way. We'll just scoop him on his side if that's where he'll be. Can you open your eyes, my friend? Oh. Where's your worst pain? In your chest. Are you happy on your side or lying on your back?
As Ian and Richard try to assess his injuries, screams are heard from the wreckage of the car, where the other 2 passengers are still trapped.
It's going one way, isn't it?
Ambulance services, the patient breathing.
The critical care team and Midlands Air Ambulance cover an area of around 6,000 square miles.
203 lifted with an ETA of 4 minutes.
The largest operating area of any specialist trauma unit in the country.
Just coming into the overhead now.
In a 12-hour shift, they will respond to around 8 life-threatening emergencies. The most frequent call-outs are to serious traumas from road traffic collisions and cardiac arrests.
That is our Lucas chest compression device. It's on the specialist platforms such as the critical care car. I think it's going to be rolled out eventually onto the air ambulances as well.
At the start of his shift, critical care paramedic Pete Edwards is testing a mechanical resuscitation device not carried on ambulances, but included as standard on the critical care team's cars.
It does continuous chest compressions, and it's a machine, it's automated, so you don't get operator fatigue. It frees up a pair of hands on scene if you're short of resources. And also, if we're going to transport the patient to hospital in cardiac arrest, it makes the journey a lot safer because you don't have to have somebody standing up in a moving vehicle doing CPR. It's all in there.
Ambulance services, the patient breathing?
No.
No breathing at all?
No.
Patient male or female?
Female.
How old is she?
How old is she, ma'am? 40, 50?
Do you have access to an automatic defibrillator?
No.
No, OK. I'm going to tell you how to do CPR. Get her flat on the back on the floor.
She's not breathing in her face, she's going different colour.
OK, well, the quicker we start CPR, the more chance she's got then, darling. Keep pushing hard and fast until anything changes. So the rate we go in is 1, 2, 3. 1, 2, 3. 1, 2, 3. Keep going.
6-2.
That's all received, thank you.
Today, Pete is paired with fellow critical care paramedic Mike Andrews. As well as the critical care team, ambulance crews and a specialist resuscitation unit have all been called to the scene.
It's a patient who's in their 50s, who's in cardiac arrest. That's not been confirmed yet because we don't have any resources on scene, although they should be, just according to dispatch.
With cardiac arrests, time is everything. Every minute that goes by without someone attempting a resuscitation, the chances of survival drop by 10%.
Hello, my name's Mike. I'm one of the paramedics. Okay. Hello, guys. You all right there? How do you?
On arrival, ambulance crew members are working hard to save support worker Vanessa.
Okay, was she asystolic when you got here?
Yeah.
Okay, so first crew, she was asystolic.
Basically, throughout. We've done a few rounds of compressions. We're trying to get access because we need to give adrenaline.
She has been asystolic without a heartbeat since they got there.
Are your family? Yeah, is it your mum? Your auntie. What's happened? Is she an asthmatic? Okay. Have you found her in cardiac arrest?
Earlier, Vanessa, who was alone at the time, called a relative to tell them she was having an asthma attack. When she failed to answer her phone after they called back, her nephew went round and found the 50-year-old collapsed. No one knows how long ago her heart stopped beating.
We've got an IGL in airway and tidal's a little bit low, so we just have to go slow on the ventilations.
Okay.
And we're just getting the reversible courses now.
I'll tell you what, I'll come around the top end. Do you want to run it and I'll go to the top end?
All right.
Mike and Pete will now take over advanced life support. Because Vanessa doesn't have a heartbeat, it can't be shocked back into a workable rhythm with a defibrillator. So they will use chest compressions and drugs to try to get it started again.
Okay, should we pause for a quick rhythm check so we can all reset and we get our timings right? So, okay, let's check for pulse in 2 places, please.
Nothing here, mate.
Okay, so that looks like asystole to me. Back on the chest then for 2 minutes, and let's see where we're going.
After each cycle of chest compressions, Pete checks to see if there is the slightest spark of life.
Hello, how you doing? Hello there, all right, how's it going?
What do you want us to be doing?
We've got this lady, known asthmatic. She's found a relative.
3 members of the West Midlands care team, specialists in accidents and resuscitation, arrive on scene.
So, just done a pulse check. We're 1 minute 20 to the next pulse check, but she's in asystole, so we're going to start trying to redress some reversible causes. Okay, all right, so have we got any access? Okay, let's get some adrenaline and the glucose set up if we can. You got in glucose, yeah? You're doing the adrenaline. Okay.
Adrenaline and glucose are stimulants that could trigger activity in Vanessa's heart.
Everybody, just a second. 15 seconds from next pulse check. We're going to take a little break in CPR and get the Lucas device on. So 8 seconds, if everybody just stands back while the care team get the Lucas device deployed. So 3, 2, 1, okay. Quick pulse check, rhythm check. It's still asystole.
After 18 minutes of manual CPR, the Lucas machine will now take over chest compressions.
So we've got continuous CPR going now.
The entire team are doing everything they can, but with Vanessa still showing no signs of life, Pete knows they don't have much time left to save her.
Can we just do a pulse check? What have we got there?
Write it all down.
Okay, there's no pulse.
Okay.
Are you happy on your side or lying on your back?
In Redditch, Ian and Richard are at the scene of a serious road traffic accident.
Can you lift this leg for me?
The driver is on the ground, semi-conscious. The full extent of his injuries is still unknown.
At the minute he's talking, he's able to speak. He said he's got pain in his chest and he wants to go onto his back. He's quite cold, but we'll just get him on his back and get him off. Have a look from there. There you go, just roll onto your back, my friend. Go onto your back, there you go.
With the help of the fire brigade, the man is rolled over.
Guys, are you okay just to give hands and we'll lift him straight on the stretcher?
He's bleeding from a wound to his head.
On the you stay there, bro. We're going to get you on the ambulance, okay? Well done.
One female passenger in her 20s has already left the scene in an ambulance. The remaining 2 passengers are still trapped in the back of the car.
How you doing? Okay.
Given the high number of casualties, extra resources have arrived.
First casualty that was ejected, we've just had a quick once over the ambulance. She's obviously trauma to all negatives, so we said Worcester for her.
Ian and Richard will focus on the driver, leaving the West Midlands care team to take over the trapped passengers when they are freed.
This chap, they've also got out. They were concerned about his airway, but he's talking. So doing another assessment now that he's on the trolley. And there's 2 people still in there that are trying to get out. So we've not had any eyes on them, but the heart team are in there trying to get them out.
The Hazardous Area Response Team are specialists trained to extricate and treat patients in dangerous situations. The fire brigade and ambulance crew are working against the clock to free the 2 remaining female passengers. One woman is bleeding from her head. An hour and 8 minutes after the 999 call, the last 2 patients are brought out of the wreckage and are on their way to receiving emergency treatment. On board one of the ambulances, Ian has had the chance to examine the driver, and his condition is deteriorating. He needs to get to hospital fast.
If you get to a point we want to intervene further, we just give a shout, pull over, jump on in the back, and then we'll go from there. Is that all right?
Yeah.
Okay. Happy?
Yeah.
Yeah.
Ian and Richard will travel with him to provide continual care throughout the 20-minute journey.
So it's a male, we think in his late 40s. Injuries-wise, he looks like he's definitely got maxillofacial fractures and possible head injury as well. He's got a black eye on the right with a very swollen, deformed right cheek. His GCS was 13 and he's a bit agitated. So query head injury. He's been cannulated and he's had some ketamine sedation, a total of 40 milligrams so far.
Arriving at hospital, Ian and Richard deliver their critically ill patient to the waiting emergency doctors.
So it's quite a different job, that from what you're probably used to dealing with. So significant RTC with quite a few patients.
After a complex multi-service job, everyone can take stock and learn valuable lessons for the future.
It's very important, so particularly that job where there's lots of people there working and lots of things going on. It's quite useful to, at the end, go through what happened at the job, what we did, what could have been done better, and it's quite useful for the crews, for their learning, because most of the regular ambulance crews don't go to jobs like that very often at all, probably once a year, if that.
It's Wednesday night, and Dr. Scott Beattie and critical care paramedic Will Meadows are at the beginning of a 12-hour night shift.
Just ahead, turn left.
Dr. Scott is a consultant in emergency medicine at Salford Royal Emergency Department in Greater Manchester and does a shift a week for the critical care team.
I can't think of a more textbook definition of a team that, in terms that everyone comes from a different background, but we're much better as a unit because we bring all our different skills and it all just comes together. It's a very dynamic team.
Will has recently completed his advanced critical care training, and this is his first night as part of the all-night trauma response unit.
This is my first shift. First sort of solo shift with the doc. So Scott's got his hands full tonight.
Au contraire.
Ambulance service, please.
Hello, can you assistance to kitchen line for a stabbing?
A stabbing, okay. And what's the address to come to?
Near the top of kitchen line, Bleeding heavily to the chest, man is barely talking. He's just found him.
Stab to the chest, was that?
Yeah, stab to the chest.
Attacker on scene?
Not known. It's a passerby that's come across him.
The police have requested an ambulance to attend the scene of a reported stabbing. With a man's life in danger, critical care backup is urgently needed.
9-8.
Got 8, stabbing in the chest.
Yeah, any details as to whether conscious breathing or not, over?
Nope, there's not even a vehicle assigned to it. I don't think they've even got the location quite right yet, but heavy blood loss.
82, over.
Last year, there were almost 4,000 knife crimes in the West Midlands. It's an ever-increasing part of the critical care team's workload.
So reports of a stabbing of a male stabbed in the chest with heavy blood loss, but we're not sure of any other details at this stage. But certainly heavy blood loss suggests that something fairly significant has been damaged. Even the smallest of little wounds could go in a very long way and hit some fairly vital organs. So quite complex, quite worrying.
If the blade has cut an artery or punctured a major organ, the man could bleed out and die in minutes. Scotland will know that the sooner they get there, the better chance they have of saving his life.
Airway is good, so
airway's good with the eyes, mate.
We're doing hypoxia. Yeah. Hypovolemia. We've got fluids.
That's glucose, wasn't it?
Okay, so we're doing the BM as a metabolic disorder.
In Edgbaston, critical care paramedics Mike Andrews and Pete Edwards are leading the team fighting to save 50-year-old asthmatic Vanessa, who was found collapsed with no heartbeat.
We've got 40 seconds until the next rhythm check.
But after 20 minutes of fighting to get her heart started, there is still no sign of life. Several of her family members are in the next room.
Will this move under her legs? Let's raise her legs, see if that helps anything. Okay, so if you push something under there, or that little table, whatever's easiest.
By raising Vanessa's legs, Pete hopes gravity will send blood closer to her heart and may prompt it to restart.
That's it, love. Okay, that'll do. Let's just keep her legs there. I know it's created a bit less room, but we've raised her legs a little bit. All right.
No one is sure how long before Vanessa was found her heart stopped beating, and time is running out for them to save her.
Can I just stop us there? We're just due next pulse check. Okay, that's pulse check there. No adrenaline on this cycle. For the next one.
So there's no pulse at the carotid.
And end tidal is 1.3 despite 20 minutes of good ALS. But can somebody have to have a chat with family regarding that, or is that all right? And I'll continue with timings. Is that all right? Okay. Yeah, let's continue.
Because they attend only the most serious cases, critical care paramedics see death day in, day out.
Is anybody in a position to find out the time of the call?
Their hardest decision is always when to stop trying to save a life.
So, what we're just thinking is, we've got an unknown downtime. We have had some CPR on crew arrival, but we don't know when she's actually arrested, and blue on arrival apparently. So the things that are going against us, she's not been in a shockable rhythm at any point. We've done 20 minutes of ALS.
20 minutes on the monitor.
Okay. Do we need to reconsult family, or are you happy with that, Buggy? Has anybody got any objections to stopping? Okay, is everybody happy to stop him? Recognition of life extinct. By my time, that's 16:13.
A crew member informs Vanessa's relatives that despite their best efforts, she has died.
Shut the door.
Yeah, definitely. So, on lift, ready, step, lift. Into here. Yeah, put it up there, right? It can be emotionally draining, I think. but at the same time, you have to sort of detach yourself from the emotional side of it if you can. There will always be jobs where you can't detach yourself. There'll always be those jobs that always stick in our minds that we all keep locked away somewhere, the jobs that, you know, you can't really forget. But I think you've got to be quite thick-skinned.
There are more than 30,000 out-of-hospital cardiac arrests in the UK every year. The overall survival rate is just 1 in 10. In Wolverhampton, Dr. Scott Beattie and critical care paramedic Will Meadows are en route to a stabbing. A passerby called police after he found a man with a serious chest wound lying by the side of the road.
4668, thank you. Verbal details of hospital.
Is it an RVP or they haven't told us one, have they?
With violent incidents like stabbings where multiple units are scrambled, police usually arrive first and secure the scene, while ambulance and critical care crews head to a meeting point nearby.
Just to confirm with you, you will be the first ambulance resource in attendance. We've had nothing come back from police.
Mike Delta 98, sorry, just to clarify, are we heading to an RVP or can we go straight to scene over?
No, just getting an update from police. I'll take us straight to scene. Police are in the vicinity.
98, yeah, perfect. We have approximately 4 minutes left to run over.
For the critical care team, reducing the number of deaths from stabbings is a top priority.
Nothing Seaton, not clear.
Their skills and experience with treating major bleeding and shock are vital when it comes to saving lives.
Okay, that's received, thank you. Our police first, are you made contact with us? No, we're just waiting. They are just in the area, so you could just see if you can locate and call back on us. No problem.
The ambulance crew has just arrived on scene, but with no sign of the incident or police, they radio back to control for further instructions. It's now been 14 minutes since the emergency call was made.
Whiskey 55, liaise with police. It looks like it may be a malicious call. They're calling the caller back and trying to make contact with them.
At the moment, the impression from the police and the first crews on scene is that, yeah, it's a malicious call. Unfortunately, it's not uncommon. We get a fair few. And it's just obviously a significant waste of resources.
You have reached your destination.
Right, I'm going to send you down. I think if there's anything, we'd have found it by now.
Yeah, 98, understood. Oh. Yard.
With no sign of any stabbing victim, the police have decided that it's been a hoax call and a wasted journey for everyone.
Obviously, make contact with medics. Going to stand the crew and myself down. Police standing down.
Last year, West Midlands Ambulance Service received over 1,000 malicious calls. In the time they've been dealing with this prank, Ambulance Control have taken 50 real emergency calls.
I guess you don't feel quite so bad. It's when you launch the helicopters, you're up in the sky and everything, and that's just a huge amount of money wasted for someone's entertainment.
Ambulance service, patient breathing.
There's been an accident on the Litchfield Road by the traffic light. A BMW has just knocked a man off his bike.
Is the patient breathing and conscious?
He's got pains in his chest.
Right, is he awake?
Yes, he's awake. Don't move him. Don't move him. He's got chest pain and I think all down the left-hand side. All down the left-hand side really hurt.
Push bike or a motorbike?
He was on a small motorbike. He's going slightly blue. Sweetheart, his lips are going blue.
Would you say that he's struggling desperately for breath?
Desperately for breath, yeah.
Okay, got a crew on the way to you.
When a car hits a motorbike, even at low speed, the injuries inflicted can be life-changing. An ambulance has been called, and critical care paramedic Steve Mitchell, known as Mitch, has also been scrambled.
We're just off to Aston. It's about 10 minutes away to a car versus Motorcyclist. Believe the patient's conscious, got a chest injury, and that's as far as we know, really. There's a crew on the way, and they'll be there before us.
If the man is struggling to breathe, he may have an obstructed airway. Mitch carries advanced airway equipment, including ventilators, so he can start treatment straight away and get him to hospital safely.
Hey up, you're all right, mate. How's it going?
10 minutes later, Mitch arrives at the scene and is met by fire brigade and ambulance crew.
No worries. I'm here. What's your name, sir?
Ian Allen.
Ian. What we'll do is we'll get you in the warm, dust you off a bit.
Yeah, okay.
All right.
47-year-old railway worker Ian was on his way back from work on his scooter when a car collided with him at a crossroads, catapulting him onto the road.
And is it your left shoulder, right shoulder?
All the left.
All the left, okay.
He is breathing on his own, but in a lot of pain.
It looks like he's probably dislocated or broken by the sounds of things. It's all right, just so don't pull anything.
There's a high chance Ian has injured his spine in the collision, so the ambulance crew have immobilised his head and neck to try and protect him from further damage.
On your count, Chief.
After 3, 1, 2, 3, lift.
Okay, stay as you are, and then slide the trolley in. Mind your toes, gently. Okay, keep going. I'll get the winch off.
Worried that the slightest jolt could leave him with permanent spinal damage, Mitch needs to use the winch to pull the stretcher up the ramp.
Okay, stop there. Okay, 1 foot, 2, half 6 inches, that's it, go. Hold on. Okay, slack taken up there, okay. Just makes it a bit smoother for you.
Once on the ambulance, Mitch needs to do a full examination to try and find the extent of Ian's injuries.
Yeah, I'm in a bit of pain.
Okay.
Can you get some gas in there, mate?
I could do some water.
Courtney, you all right to get some morphine drawn up and some paracetamol? He's in a lot of pain.
Well, yeah, I'm in pain, yeah.
Okay, here's a little bit of water. Just wet the whistle. Out of 10, how bad would you say the pain is in your arm?
It's pretty bad.
10 being the worst ever.
It just feels like there's something wrong there.
Yeah, it will be.
It's my chest.
Your chest?
Shoulder.
Yeah.
All round there. It's really pain. It feels as if...
Chest up here as well?
Further down here.
There. Okay, right, okay.
Ian is in so much pain, it's clear that he has sustained some broken bones and potentially damaged internal organs.
Keep your arm low for me, Ian, okay, so we can pop a little needle in there.
Mitch's first priority is to reduce his pain so he can get him to hospital fast.
Get your pain sorted out, mate.
Ambulance service, patient breathing.
He is, but it's not very good.
She conscious, the patient?
No.
Not responding?
No.
How old's the patient?
Not really sure, he's 1934.
So he's 85 years old and he's not responding to you at the moment, you confirm,
No,
no?
he's very, very pale in colour, very pale.
Is he taking regular breaths at the moment? Is his chest rising and falling evenly?
No.
Right, I hope it's all been arranged for him, okay? We are trying to get there as quick as we can on blue lights and sirens, okay?
The call is from a local care home. It is classed as a cardiac arrest, a code red emergency. An ambulance is en route, but critical care paramedics Alistair McNeil and Mike Andrews have also been scrambled.
What looks like a nursing home or sheltered accommodation for a cardiac arrest. Charlie 1 call. We're responding as we are one of the closest resources to the case. We have another crew that are en route as well, but no one on scene yet, as far as we know.
In the UK, around 7.5 million people are living with heart disease. As we get older, the heart and blood vessels stiffen, meaning the elderly are at greater risk of sudden cardiac arrest.
This is the time of the morning when people are getting up and they're moving around, and carers are making their first sort of visits of the day, so this sort of case is not uncommon at this time of day. A lot of the time they're hypoglycemic patients, so they're diabetics or even non-diabetics whose blood sugar has gone low and they've been found in an unconscious state.
Still a couple of minutes away from the care home, Alistair and Mike know they need to get there fast if they are going to intervene and save the man's life.
What we're going to do is we're going to get a needle in you, give you some pain relief through there, and that'll help the breathing, all right? Clench your fist a few times. That's it.
In Aston, Mitch is treating 47-year-old Ian, who was knocked off his scooter and has suffered serious chest injuries.
So he sat for 95 on air, just sort of coming up quite quickly there as well.
4 litres there?
I'd go up a bit. Yeah, he's having a bit of difficulty breathing, I think, and like what's happened. Sharp scratch then. Okay.
Ian needs an urgent scan of his chest and lungs and is in so much pain it's affecting his breathing.
Yeah, sorry, Chief. Well,
I'm in a lot more pain than I was out there.
Yeah, it kicks in once your own painkillers wear out your system. If you want to chuck us that morphine, I think.
Any allergies at all, Ian?
Not really, no.
So this will make you feel a bit fuzzy, OK? Out of 10, how bad would you say the pain is there?
I'd say it's pretty bad. I'd say it's about 8 out.
About 8 out of 10, and you look like a burly chap that can take a bit of pain.
Ian's blood is showing low oxygen levels. He may have damaged his ribs and lungs, but until he can get on top of his pain, Mitch can't be sure of the extent of his injuries.
Can we just pop your head forward slightly? Not too much, not too much. Rest your head back. Rest your head back. OK. How's that? Can you feel that starting to kick in a little bit there?
Yeah, I'm a big bloke and might take a while to get round.
Yeah. Nice slow breaths if you can. How's the pain doing there, Ian?
It's subsiding, but it's still there.
Yeah, OK, we'll get you. Yeah.
Have you put the morphine?
Yeah, that's gone through.
Yeah, it's gone through.
It's working now.
Yeah.
14, 20, it started running through.
Finally, the combination of paracetamol and morphine start to take effect.
Stuttering his respiration there. I'll probably give him a little keep going until you've done the 20, I think.
With Ian still struggling with his breathing, Mitch decides to keep him on oxygen for the journey to hospital.
Oh, we'll probably end up going QE, I think, because he's got a chest injury.
Yeah.
How old are you, sorry, Ian?
47.
47, OK. Maybe just put a 250 bag of fluid on there, just run the rest of it through, just give him like a bit of a keep open or something like that.
If his blood pressure drops, the intravenous fluids will help to keep him stable.
Are we putting fracture left?
Ribs and shoulder injury. Left, yeah.
Police arrive to get details of the accident, and Mitch calls the trauma desk to update them.
Impacted you?
Well, I've gone into the side room, so
So where did you impact the car?
6-2, go ahead.
front wing.
Crew are going to convey to the QE. You ready for details?
In the right hand
Well,
lane.
at first, I moved
Yes, fire ahead, thank you.
So, male on a small motorcycle moped. He's got a left shoulder lateral clavicle pain with left sort of lower rib injury, query fractured ribs, equal air entry, but it is affecting his respiration. And in light of his rib injury, I feel that it's suitable for the QE. They'll probably be about 15 minutes from now.
With Ian now in a stable condition, Mitch is happy to leave him in the care of the ambulance crew for the journey to hospital.
There's the crew.
In Quinton, Alistair and Mike have been called to a care home where an 85-year-old patient has been found in an unresponsive state, bleeding from the nose.
Good morning. Hello again. Hello again. You're right.
They are met by the ambulance crew, members of the care home staff, and happily a now conscious Ken.
So which nostrils of blood come out?
Both of them.
Both of them.
Ken and his wife Maureen have lived in their apartment in the care home for 8 years. He collapsed this morning getting out of bed.
How is he normally compared to this?
Well, we don't come into him for care.
So you don't know him too well? No.
Well, we know him, but we don't give care to him.
I know me, I'm always pulling the legs out.
Is that what you do?
Yeah.
Oh, keeps them on their toes, I would imagine. So when you sat up, you just felt a little bit dizzy?
Yeah. I stood up and when I got round here, there. It happened yesterday as well.
No.
Can I take spot of blood out your finger?
You can have it. Yeah, you can have it from anywhere. I'll give about 2 points while I've been in there.
Yeah.
You lost a lot from your nose, have you?
You've had no chest pain or anything, have you?
Nothing at all.
The crew take a sample to test Ken's blood to see if low blood sugar could have caused him to pass out.
Okay.
He was getting out of bed and the blood not going around my body quick enough.
Did you leap out of bed, did you?
No.
What was that? That normal?
6.9.
6'9"?
Yeah, 36.8 and 6.9.
Are you happy with his ECG and everything?
Yeah, I'll do 12.
The electrocardiogram test hasn't shown up any abnormalities in Ken's heart rhythm.
I can't manage it, Lord.
No, I know you can't.
If I hadn't given you this word, you'd have been flat on the floor. And I couldn't lift you up.
Happened again yesterday as well.
No, of course it didn't.
But Alistair is concerned that this is the second time he has fainted in 24 hours. The nosebleed could be a sign of high blood pressure or heart disease that needs investigation in hospital.
I don't think there's any need for me to go to us.
But Ken is not convinced.
We'll do all our checks on your Ken and then we'll take it from there, mate.
I ain't got to go.
Claire's coming.
I'm not sure what we're doing.
Ken has a history of fainting when he gets up in the night, but has never had a proper diagnosis.
Did he go to hospital yesterday?
You didn't go to hospital last night, did you, Ken?
No.
You had it happen yesterday, you've had it happen today.
It happened yesterday morning, then he cleared up, not all right.
The carers.
What was his BP, James?
You've got to go in. You were out for the account.
Got a good one.
Just.
Mike wants the crew to run another ECG scan to see if there are any signs of deterioration or unusual activity.
That's a nice scar you've got on your chest, isn't it?
What's that from?
20 years ago.
Oh, 20 years ago.
25 years, more than that.
Really? It's indestructible then, maybe.
A veteran of open heart surgery to unblock clogged arteries, Ken is made of stern stuff. But in the end, he listens to medical advice and agrees to go with the ambulance crew to hospital.
Okay, take care. Thanks very much. Thanks a lot, guys. Nice one. We'll leave you to it. We'll see you later on, no doubt. Nice to see you.
And Mike and Alistair are free for their next emergency call.